ADPKD is a lifelong multisystem disease, which means you're born with it. It hasn't been your fault because it's an inherited disease. It's not even the fault of your parent if you inherit it from your parent. It's something that happens. It's a disease. Now, yes, it's a big diagnosis. It will affect the kidneys. It will affect the kidney function. But it's important to always take it in a positive light, that we can do much better with PKD. We don't have a lot of complications from PKD if we take good care of ourselves. Now, it's important to understand that although ADPKD is a lifelong disease, you shouldn't let the disease define you. Make sure you have a good team of caregivers, friends, families who can help you navigate at different stages of the disease. Early on, maybe you don't need a lot of help because there's not a lot of doctor's visits, you're feeling fine. But later on, as more things are asked from you, it's good to have someone to help you. It's good to advocate for yourself, which means you need to know what's the best thing out there and know how to ask for it, know how to ask the right questions and go to the right teams.
I think it's really important to advocate, read, learn about it, understand it, know your blood work, understand your blood pressure, monitoring these things so that you are well informed and can have intelligent conversations with your doctor and be able to make adjustments as you move through the journey.
I feel that educating patients about their condition and treatment options empowers them. The more I educate patients in our visits, I feel that our visits ultimately lead to shared decision making, which allows the patient to feel in charge of their care.
Being your own advocate is really important, but it's the knowledge. It's reading research studies. It's reading books about a PKD diet. What should you eat? What shouldn't you eat? Monitoring caffeine.
Look for what's the standard of care. Look for clinical trials. Be engaged with your community. Try to develop the PKD walks. Try to engage with other patients who have similar journeys, because also that's powerful to know that there's other patients who've been through the same challenges that you have, and that's also powerful for you to kind of make it a little easier in your journey.
So when I learned that PKD was a common genetic kidney disease, I said, how could that be? No one's ever heard of it. It occurred to me that I really felt like I needed to talk about this. I needed to get the word out there about it. So my husband came up with an idea of a golf tournament. I laughed back then as I knew nothing about golf.
We came up with trying to figure out the possibility of running a golf tournament. So we decided to start out with our first Driving Home a Cure for PKD golf tournament. That was the original title back in 2001. And we raised, I think, $17,000. Since that point in time, and it has morphed over 23 years now to raising more than $2.4 million, all for research for polycystic kidney disease.
We kept building and tweaking and finding ways to keep it fresh and keep it interesting. And then I used it as a platform to talk about PKD. I used it as my way of sharing my story.
What's so important about fundraising? It's all about research, but it's more about getting the message out, that everybody understands what PKD is, because we feel that anybody that does any fundraising event should understand PKD comes first. Tell everybody what it is, tell everybody what can be done to get a cure and go from there.
I especially find value in educating people about PKD, about patients learning about their disease and management of the disease, learning how to maximize doctor's appointments, going in with lists of questions that will help them partner with their healthcare professionals. It's ultimately up to you as a patient to manage it. And the doctor's there to help guide you and assist you with that effort. And I think that's all part of anyone's health journey, especially PKD.